My research project is on comparative oncology, parallels between human and canine cancer research. So comparative oncology refers to the integrated field between any animal oncological studies and human oncological studies. So the benefit of this is that worldwide, cancer is a well-researched disease that still has implications today that need to be solved. So some needs in the cancer research field are definitely the problem with metastasis, because research in that field is limited, as well as treatment, because treatment needs to treat this primary and secondary site when cancer metastasizes. And most cancers, upon diagnosis, are already metastasized, and I'll talk about that later on. Furthermore, the use of clinical trials is a major aspect of oncology in general, as well as comparative oncology, and there's an extreme lack of patients participating in clinical trials, with less than 5% of human patients participating in clinical trials. So previously, in clinical trials, mice were used. However, mice are not exactly an accurate representation of human cancer, as they are not naturally progressed with cancer. They have cancer injected into them, which does not accurately represent human cancer, as human cancer progresses naturally. Furthermore, they have a chromatin overlap of about 10 to 20%, whereas canines, which I'll be talking about later on, have a chromatin overlap of about 40 to 50%, which demonstrates the genetic similarity versus the mice. And furthermore, since the sterile environment with the mice is not accurate to that of the environment that humans live in, there are epigenetic factors that canines can present that mice do not. And that's one factor, is that canines live in the same environment as humans and kind of take in the same carcinogen as well as epigenetic factors, unlike the mice. So, with clinical trials, they are very expensive, and a lot of the times there's a high drug attrition rate, which basically means that the drugs that are being produced after clinical trials are not successful in humans, which is to be found a pretty high percentage in mice. However, since the genetic similarity is extreme in canines, between humans and canines, the clinical trials have had a higher success rate with drugs as compared to those with mice, as well as they are lower cost due to the methodology in which they're conducting these trials, as they use pharmacodynamic, and pharmacokinetic factors that help to reduce the amount of drugs entering each phase of the trial, which is phase 1, 2, and 3, and then approval. So I'll be talking about two different types of cancers today. I'll be talking about osteosarcoma and melanoma. So to begin with, osteosarcoma is a very rare cancer in humans. It's typical in younger humans, with like children and teenagers, but again, it's very rare. It's the most common bone cancer in humans, though. However, in canines, it is extremely common. It's one of the most common cancers found in canines. So to begin with, it metastasizes in the same manner, usually to the lungs, as well as the brain and the heart. And furthermore, it presents itself in the same way histologically, which basically means if you take the cancer underneath a slide and show it to somebody, they look pretty much identical. And you can see right there that there are some differences, but in that manner, they look identical. So genome-wide studies have been done, and they're called GWASs, and they have found that the same germline risk factors between humans and canines have been linked. So basically that means that the genes that have been known to be associated with osteosarcoma in humans have been found the same in canines. So what can we do with this? Basically, treatment. Since you know that the canine osteosarcoma and the human osteosarcoma is similar genetically, you can apply that to treatments. And what I found is that a specific case study was done with rapamycin that has been in clinical trials, has been done, and it's basically an inhibitor, which it forms with the FKBP12 complex and inhibits translation of these cancer cells. And that's been successful in canines, and which means that they can use comparative dosing cohorts to apply that to humans through clinical trials. So again, this is the same presentation histologically. So now I'm going to be talking about melanoma. In melanoma, the most applicable for canine melanoma is non-UV related for for humans. Since canines have fur covering their skin, the UV-related malignant melanoma is not as applicable to canines and humans. Like, the link between is not as similar, but non-UV linked is extremely similar, specifically with oral and mucosal melanomas. So mucosal melanomas are typically rare in humans, as that's not the most common form of melanomas for humans. But in canines, oral represents about 62% of that malignant melanoma. And as well, there are specific breeds that present this type of cancer more common than others, and that's typical of almost every type of cancer for canines. So for oral melanoma, it is poodles that are most common, and the benefit to this is you can take a bunch of poodles or whatever breed that is for understanding a certain type of cancer and study those genetics, since they are very similar genetically due to years of breeding and breeding. And you can take those and do germline risk association processes and understand what is the risk for cancer and apply that to humans. So the first step for malignant melanoma is surgery, but since it is an aggressive cancer type, there is therapy and chemotherapy that is needed to further that. So since it is hard to treat, that's the need for it for canine cancer. So they have found all of these signaling pathways that are connected between humans and canines, as well as mRNAs and inherited risk loci factors. And they found about 33 different inherited risk loci factors for osteosarcoma and melanoma. So where is this going? There's a Comparative Oncology Trials Consortium that is represented by the NCI, which is the National Cancer Institute, and that's big because collaboration between veterinary oncology and human oncology is the pathway to understanding both canine and human cancer. So currently, the NCI sponsors about 50 different universities for understanding these, which not only can the students learn about their own veterinary pathways, but they can collaborate with other schools and understand the implications for it for future references. As well, the funding needs to increase. However, pharmaceutical companies are sponsoring clinical trials at the moment at about 18 different universities worldwide, or not worldwide, nationwide. And so, furthermore, people are more motivated to have their dogs increase in clinical trials, which is huge because due to the low patient accrual, dogs are a big benefit since a lot of households in the U.S. have dogs, and they do this voluntarily, which basically, if you want a novel cancer treatment for your canine, you're motivated to go into these clinical trials, which is a huge step. And if more people understand that they can get cancer treatment for their dog while helping other people, they'll be more motivated to try this in the future.
Okay, Sommer, I want to just, the first thing that I thought about when you talked about this is, where does PETA come in on this topic?
Right, so the research I did, they were all voluntary clinical trials, so I didn't research the side of any sort of mice or any sort of forced canine clinical trials. I'm not aware of those. I don't know if they're happening, what's going on with those, but all of the studies I found that are regarding treatment as well as genome-wide association studies have been conducted with voluntary dog applicants.
And these are dogs who already have presented.
Yes, they're naturally occurring cancers.
Trying to give them cancer.
Correct.
Well, they used to. I mean,
Yeah.
Do you know why there's such a higher rate of cancer in dogs than in humans?
So due to their lifespan, dogs over 10 have a much more increased risk for cancer. I believe at like age 10 or 10 to 13 for dogs, about half of the population of dogs get cancer, and that's just due to the amount of lifespan they have. So if you take a human lifespan and kind of shrink it, that'll give you an accurate representation of human cancer, but in a different species.
And with the non-UV cancer, you showed the pictures now. Is that are dentists the ones that are then catching that? Is that becoming their area? Not that they would treat it, but is that who, because typically when you go to a dermatologist, even though it's an IUV, you'd still be getting
Right.
checked for melanoma. How do dermatologists look in the mouth?
So what I found with the oral melanoma is that there's a more risk factor for different race populations. So Asian and Black populations actually have a higher risk for oral melanoma as compared to white populations. So I'm not quite sure if they check for that as a dentist or if the person themselves just recognizes that. But there are different inherited risk factors that I'm sure people are aware about and are cognitive of when they understand that what's going on in their mouth is a little strange.
Are your interests with the veterinary sciences? or-
Right, yes. So that's kind of what piqued my interest is I wanted to go on the veterinary check, and I wanted to understand the applications of like the crossover between the two, because I think that's super important in any field, honestly.
So my dog was just
Mhm.
diagnosed with lymphoma.
Right.
This summer. So do we have universities in our state that are running clinical trials, or to your knowledge, or?
So I did look at UF, and they are running some clinical trials. Lymphoma is another big one. I didn't dive deeper into that, but from the papers I read that they did say that there's a lot of crossover between lymphoma, specifically I think it's B-cell lymphoma, and non-Hodgkin's.
ENT, I think it
Right.
is, yeah.
So those are distinctly similar between dogs and humans.
You know, they know why? Is it environmental, is it food, or?
So from what I found, they didn't really talk about the epigenetic factors, mostly just the genetic factors in that role.
Just a quick definition, so is epigenetic is outside
Yes.
causes?
Yes.
Are certain breeds more susceptible, I mentioned poodles, and
Mhm.
do they find certain types, breeds of dogs are more
Yeah,
likely to
so
get
for osteosarcoma, it's more common in large breed dogs, such as Buse Shepherds and Burmese Mountain Dogs, and that's who they use to understand these cancers. I'm sure other dogs get cancers, but due to like years of selective breeding to get certain traits, it's like much more common for certain dog breeds to have certain types of cancers, and that's even like when you say that certain dog breed, veterinarians automatically like recognize that those dogs get a certain type of cancer.
And do like purebreds are more susceptible than
Yes.
mixed
Yeah.
breeds? Yeah.
Yes. Yes.
Yeah,
So,
my guess.
if you had an opportunity to continue this kind of research,
Mhm.
where do you see it taking you?
I think I personally would focus more on the veterinary side of it just because there's so much research going on in the oncological field that I'm not aware of. And I'm sure that's the same for veterinary, but I think I would like to take a deeper dive onto like the genetic portion of it just to kind of understand, well, what are the risk factors for dogs, and like see if there can be, because humans we have screening for certain genetic factors. I would like to know if the same can be done with dogs and maybe possible prevention for that type of cancer.
So, do the drugs that they give dogs for
Mhm.
cancer, is it, there's a sense that their liver, their organs will process the drugs not that dissimilarly from humans?
So it all depends on the dosing cohorts, which the methodology is different for every type of dog based on the weight and other factors such as that. So, I mean, these clinical trials are super important, and that's why there's so many phases of it just to test the drugs, but they do make sure that before they're administering the drugs to all humans, that they are safe for the humans.
Are they doing the immunotherapy now on dogs?
So that's actually a newer concept. The research papers I did aren't deep diving into that, but they are talking about how it can be very applicable in the future. Yes.
Are there certain universities that are kind of leading this field?
So Duke is a big one, as well as Purdue. Purdue actually had like a very nice layout of why it's important, and then Duke had a big I guess funding you could say is one of those. I'm trying to think. There was one more, that Cornell as well. So a lot of the higher schools are looking into it.
Like, what kind of scale would they have, like, amount of dogs that they're trying to treat at
So from the studies I looked at, it's a couple hundred, and depending on the breed, it's probably harder to get a certain type of breed than just dogs in general. But I think it also all depends on how many people are just willing to have their dog participate in these clinical trials, and I think that's why getting this idea out there is so much more important, because I wasn't aware of this. I think, as we get older and people have dogs, it should be kind of more of a common thing. I mean,
So for the rapamycin, was that just for dogs, or was that something that they were like trying on dogs and then is hopefully gonna maybe move into like clinical
So,
trials for humans?
they determined that it was successful in canines, and then at the end of the paper I read about that, they said that they would continue this process in terms of humans, so they didn't just cut it off at dogs. I'm not sure quite what the outcome was for the humans, but they did continue that study. Mhm. Any questions?
Just so you know, we have a member of our homeroom who has a Chihuahua, and the dog has a melanoma under the eye. They had to remove the eye,
Mm.
and they're now dealing with trying to engage in other treatments. So it's been a traumatic summer for one of our crew. Just want you to know that.
Do you know why it's more occurring in the full breeds than the cross breeds?
So, over the years, due to selective breeding, these genes that they have in common with each other, I'm not quite sure why that is, but I do know that these certain genes are inherited risk factors, and so that would be more common in certain breeds than others.
Okay. So it's more about which breed, not as much, it's, okay.
I mean, I'm sure there's other factors such as environmental that affect certain types of cancer, maybe food, maybe just environmental. But from what I've learned from this presentation, there's definitely like specific breeds that are associated with certain cancers.
What other animals are good fits for?
So they've talked about mammals in general just because they mimic humans better than reptiles. I mean, they use mice just because they're easier and more cost effective, which is true, but it's just that sterile environment is not accurate of human cancer. And I'm sure the same thing could be said for other animals. Because canines have such a presence in our society, I think it makes them more accessible. But
Is there a higher percentage of, you may not know, I'm just wondering if there's a higher percentage of cancers in dogs or cats?
I didn't look into cats. None of the papers talked about cats, so I'm not quite sure.
And or pigs, I'm just thinking of why, I know that they do a lot of pig work with pigs and their organs. I'm just curious which animals have the higher incidence of cancers, and if anyone's ever tried to figure out why that would be.
That would be something to look into. Yeah.
When they do a clinical trial, do they have to restrict it to just one type of breed, or can they breed
No.
all different kinds of dogs?
I think most clinical trials start out with, unless they know that a certain cancer is like very much specific to one breed, they start out with a big pool of however many dogs they can get, and then kind of narrow it down from there and see like, and I think it also depends on the clinical trial to see what they're studying. If they're studying a specific cancer in specific breeds, then that's different than just dogs in general.
Do you know what the schools that are doing these clinical trials and stuff, like what mechanism they have in place for reaching out to different like vet offices? Like how are they able to communicate and get dogs in? Like how do you get the word out?
Communication wise, I'm not quite sure about that. I'm sure that those types of institutions have a lot of connections that they can make. Since they're sponsored by pharmaceutical companies as well, it's not like the people are paying anything to have their dogs involved in clinical trials. But getting the message out there, I think, is one big step that needs to be taken, because none of the papers I read mentioned that. And I think that's a big thing for understanding, since there's there's no involvement in human clinical trials, and I'm not quite sure if people are just hesitant to do that because they want conventional treatments, or if they're scared of novel treatments, or they just don't know about these clinical trials. I think that's a big part of it is communication and collaboration. Yes.
Okay, this is an ignorant question. I just don't know. So when we're talking about like pharmaceutical companies,
Yes.
are the pharmaceutical companies the same for animals and humans? Are they collaborating?
That's a good question.
That's
They never specified
people
which
or-
pharmaceutical companies they were. They just said pharmaceutical companies in general. So I would assume that they are the big pharmaceutical companies.
Yeah.
But I'm sure vets have their own pharmaceutical sections,
Like a
just
branch.
because they are different than humans and have their own different types of drugs. But there is
Yeah.
some crossover between what drugs.
There have to be some collaboration to get it
Right.
tossed over to the
Mhm.
human side.
Yeah. Yes.
I see that Dr. Jutras was your vet
Yes,
chart.
yes.
Does he have any connections still with UF? Like, was he
Yes.
keep working with them or
Um,
to them?
So I'm not quite sure if he's still working with them, but he did attend UF, and he knows that they're still involved. He talked about osteosarcoma a lot, and they're doing research in that, which is a big one. But yeah,
Has the rates of cancer increased in dogs in recent years?
there was nothing in the paper to indicate that. I do believe it's just the amount of cancer in dogs is due to the age, especially in dogs with a shorter lifespan, such as big dogs. They tend to, from what I saw, there were no studies, or there probably are studies, but from the studies I read, they are mostly large dog breeds, and since they live a shorter period of time, their cancer shows up in a shorter period of time, so that makes them more applicable to the studies.
What kind of veterinary studies do you want to go into?
Oh, I'm still deciding between like large animal, which is a whole nother thing, like zoology and veterinary school, or just small animal, which incorporates all dogs and cats and pets. So
You should do large animal and go check on those hippos and.
yeah, I should.
Just saying.
For sure.
So.
All right, thank you.
That was great.